Okay, so we will get started. Thank you for joining us. I am Michaela with Northeastern Mental Health, or excuse me, sorry, Northeastern South Dakota Area Health Education Center. I am the Director of Community Programs, and we are grateful that you guys are all here at our webinar today. Just a quick notes, we are, this series is funded by HRSA and the Aberdeen Area Community Foundation. A couple of housekeeping items before we get started. We will use the chat area for any comments or any questions throughout, and someone will be monitoring them. We also will have a little bit of a Q&A at the end, so if you have any other questions, we will have that time as well. And then finally, if you are not registered but would like CEUs, please message me throughout the session and I will make sure you can get those. So thank you, and I will hand it over.
Thank you, Michaela. Let me get our PowerPoint pulled up here. Everyone see okay?
Yep.
Awesome. Okay. We'll try to do our best to monitor the chat for comments and questions. But thank you all for coming to the webinar today. We are excited to speak to you about the use of telehealth for the delivery of applied behavior analysis therapy. Today we're going to speak about kind of a shift in or from in-person modalities, some ethical considerations, and access to care related to ABA therapy. I am Taylor Byrne, and I am a BCBA, and joining me is Jessica Herbert, who is also a BCBA. We work for an ABA agency, and we'll talk a little bit more about what we do, who we are, and then kind of how we've shifted over the last couple of months. It feels like more than a couple of months to a telehealth service delivery model as well. Jess, do you want to introduce yourself real quick just so people can see you?
Hi, I'm Jess Herbert. I'm a BCBA, like Taylor said. I oversee our clinic in Aberdeen, but I'm based out of Sioux Falls, so I do a lot of telehealth supervision work anyway. So yeah, hi everybody. Thank you for coming.
All right, so just a little bit about us. So ABA eCare is a division of ABA, or Applied Behavior Analysis agencies, as a part of a larger parent company that we belong to. So Jess and I work for behavior care specialists. We both have experienced telehealth service delivery for quite some time, not just after the COVID pandemic. So we've had some experience with supervising the delivery of ABA therapy to individuals with autism, and then also supervising the behavior technicians who deliver that therapy to these individuals as well. So we have a couple of other sister companies that provide ABA therapy as well, and we'll talk about that a little bit too. So behavior care specialists is primarily located in the Midwest. We have centers and clinics in South Dakota, Minnesota, Iowa, Wyoming, and Texas. Texas not being in the Midwest, but we're located there too. Interventions Unlimited and Alpine Academy are our sister companies, and they are located in Florida. And then ABA eCare, which is really our kind of our telehealth service delivery division, is able at this point to provide telehealth services in these 6 highlighted states. With eventually, our goal is to be able to provide ABA therapy virtually anywhere, essentially. So as we kind of progress through the logistics and getting approval through our payers, things like that, we hope to increase access to care through virtual or telehealth. So a little bit about applied behavior analysis. If you aren't familiar with it, ABA is the gold standard treatment and really the proven method used to treat the global symptoms of autism spectrum disorders. With early intervention, ABA has shown tremendous positive effects on children's developmental trajectory. So really, the key to ABA strategies is teaching really kind of complex skills in smaller steps, and building on those dependent on the level of mastery for each of those individuals, and then moving on to the next step. So we do this by using positive reinforcement, which then kind of motivates continual improvement of those skills and reduction of challenging behaviors. And then additionally, we track progress pretty systematically and evaluate that pretty much continuously to ensure that each of the skills that we're teaching or the behaviors that we're targeting are integrated into every component of the individual's life and done so kind of systematically. So a little bit about the services that typically are provided in an ABA agency or setting. So some specific to BCS and ABA eCare, we do diagnostic evaluations, one-on-one ABA therapy in a variety of settings. So whether that be in home, whether that be in clinic, and of course, what we're talking about today in a telehealth setting. We do in-person and virtual social skills groups. We have special education services with ABA or applied behavior analysis based principles kind of embedded into that academia setting. And then we also provide parent and caregiver training and consultation as well. So I think we could all probably ramble off our own definition of telehealth, but just so we're all on the same page, as defined as telehealth is defined as the use of electronic information and telecommunication technologies to support and promote long-distance clinical healthcare, patient and professional health-related education, and public health and health administration. So kind of how that relates to telehealth and the delivery of applied behavior analysis therapy. The Council of Autism Service Providers in 2020 kind of defined what the parameters are of telehealth for this, for our field. So telehealth is a means of delivering healthcare, not really a specific or a separate, distinct healthcare service. So we deliver ABA therapy. We deliver that face-to-face in person, but we also have the ability to deliver that via telehealth. So it's not necessarily a separate treatment model. It's ideally incorporated into the treatment package, whether it be in person and or telehealth or virtual as well. It is a service delivery model that allows providers to deliver the healthcare service directly to the patient without requiring the patient to travel to receive care. So we'll talk about some of the benefits of telehealth later in the presentation as well, but that's one of the most, I think, meaningful pieces too, is that the access to care, not having to travel, and really families being able to join basically with the click of a mouse or jumping on their phone. It's pretty easy. So specific to ABA and telehealth services, there are a few different models that we've implemented and that have been kind of streamlined throughout the pandemic and then before that as well. So there are partial telehealth models. So a family or a child may receive in-person services with some component of telehealth delivery as well. So additionally, telehealth direct services with telehealth clinical direction. So the child is receiving direct services or therapy via telehealth, and then additionally, the clinician is supervising that individual's progress, the behavior tech who's working with them from a telehealth model or standpoint as well. And then there are caregiver implemented services. So in-person services have been disrupted, or we're not able to do that. So the child can't respond to telehealth services or therapy without the assistance of a caregiver or parent. So that caregiver or parent kind of serves as a proxy, or like a therapist, I guess you could say, with the direction of a behavior technician or a BCBA, or what Jess and I are board certified behavior analyst. And then the last telehealth model is caregiver consultation. So we have in-person services resuming, but families need to have a level of involvement in the treatment package and the delivery of those services. So we have the ability to consult and provide some training to caregivers and family members from a telehealth perspective as well. So why should we be providing telehealth services for applied behavior analysis? ABA is absolutely an essential health service and is medically necessary. I think the most important piece of this is an increased access to care and services. So being in Minnesota and Wyoming and Iowa and South Dakota, talk about rural. We live it, we know it. So using this telehealth model, there is a huge increase in access to services for those rural areas. And two, I think it's lowering the cost of services as well. So if families are traveling in hours, some of our families are traveling longer than that to get to a clinic in order for their child to receive services, that can be a huge barrier and a cost to them. So I think those are two important factors to note. Additionally, I mentioned this earlier, but within ABA, we really promote the family and parent involvement. There has to be that piece in order for the generalization of the skills taught at the center that are happening at school, that are happening at home. And using telehealth is a really nice tool in order to enhance or increase parent participation. So sessions can take place virtually anywhere at any time. So we can really be flexible as providers and agencies to kind of meet the needs of the family and the parents with the scheduling piece. All they really have to do, as we'll kind of talk about this too, is just have the technology and we can have the availability. And then last, it allows us to plan and be really proactive for kind of an abruptly disrupted service like face-to-face. So unfortunately with COVID-19, there's definitely a piece of abruptly disrupting services when we think about that face-to-face. So having some sort of telehealth application in the treatment package, whether it be supervision of the case, whether it be observation of the therapy, whether it be a caregiver consultation model, really helps kind of mitigate those steps that you need to take if there's an abrupt disruption in in-person services. So more recently in our field within behavior analysis, over the last couple of years, there's been kind of a new movement towards research in the efficacy and ethics too of telehealth service delivery and what that needs to look like and kind of implications of that. So the question directing telehealth research is not whether the interventions that we're using in center or in the clinic or in home with the behavior therapist are going to be as effective as they are delivered by the parent or in the home virtually. It's really identifying which treatments to use with telehealth and how to ensure that those are being done with fidelity. It is a new modality. I don't think a year ago, most behavior analysts thought that we would be delivering ABA therapy virtually. We've all had some experience of supervision and case management over telehealth, but not really the actual interaction and delivering the goals and the interventions through telehealth. So it's definitely been a learning curve for all of us. Each day, I think we're learning new things and becoming more familiar and growing in that aspect as well. So, and just a caveat here, telehealth may not be a replacement for in-person visits or in-person therapy. It really is individualized for the client and family need. So the next couple of slides are just recent literature and research related to behavior analysis and applied behavior analysis therapy through telehealth. So if you're interested in learning kind of some more information and details and evidence of success, there's some research for you too. All right, and with that, I'll pass it over to Jess.
All right, so when we're looking at implementing telehealth with a client, we really have to look at the appropriateness of telehealth. Like Taylor had mentioned, it may not be appropriate or may not replace that need for in-person visits or in-person sessions in the clinic or in the home or in the school. So in order to decide if it's appropriate or not, there are lots of different tools out there to decide appropriateness. One of them that we look at using is we want to look and make sure that the caregiver has access to the required technology and do they have an internet connection. Can't do telehealth without internet. And then the required technology would be something like a laptop with a webcam, an iPad, another sort of tablet with a webcam, a smartphone with a camera, other platforms like we use Zoom, Google Meet, or Google Hangout, I think it's called. All of those, we want to make sure that we have access to that as well as access to the internet connection. It's a stable internet connection. And then the second thing we also look at is have we determined whether or not the direct services that we provide could be provided via telehealth, or is that going to result in potential harm to the client or to the caregiver? We obviously don't want to put anybody at risk of harm. And so that's one thing we weigh heavily, especially with those individuals that may have severe problem behavior. It might not be the best option to go with telehealth, or even severe self-injury, again, might not be the best decision to use telehealth just because we can't block those and protect them. We also want to make sure that there's somebody available to follow the behavior analyst direction, whether it's a behavior therapist from your company or it's an adult. Sometimes a lot of the individuals that we work with struggle to attend to the computer, or maybe they don't quite understand, or we need the parent or the caregiver to tell us, oh, little Bobby is pointing to the apple because we can't see via telehealth. So just some things we need to look at when it comes to implementation. And then we also look at what protocols are we implementing currently. Are there ones that we cannot deliver because of like delivery format, like they have to be done in person and we couldn't do it via telehealth? We also look at protocol, again, with the protocols, can they not be delivered via telehealth due to limitations of the caregiver? What are the caregiver's limitations? How much time can the caregiver schedule in the day? Like maybe they're not able to schedule the whole 6.5 hours that we normally would see the client in the clinic for, but they can do 2 hours a day. We can also look at just physically what's the environment like. Is the environment going to support the caregiver and the client working through telehealth with the BCBA or the behavior therapist? Go to the next one. So another tool that we use to determine whether or not telehealth would be appropriate for our clients is we look at risk assessments and informed consent. This is a tool that we also use as a part of determining whether or not telehealth would be appropriate for our clients. We also look at the research and the resources, for determining risks. And then we also talk with parents, caregivers, guardians, and obtaining informed consent. So we talk to them about what we want to do, what we're planning to do, how we plan to approach it from the telehealth perspective, what programming we can run via telehealth, how we're going to support the family and the caregiver during the session and kind of guide them through how the session's going to look, like what I'm expecting of you, what you can expect from me, how we're going to target this, how we're going to document progress, all that kind of stuff. We kind of talk about in the informed consent part as well. Go to the next slide. So there are some risks of using telehealth, just like there's risks to everything. Factors that we do look at are like treatment modifications. How many modifications to the treatment plan do we have to make, or the behavior plan, or the academic plan? Like what kind of stimuli are we going to have to do? Is there a way to do it via telehealth? Can we find websites and engaging ways to teach and to present the material to the individual? We also want to look at the environmental modifications. The clinic that we work in is set up in a way that it promotes ABA, but if we're going to be doing telehealth and the client is at home, how can we set it up so that it's distraction free in the environment for the client so they can focus on the computer screen, focus on what the behavior therapist or the BCBA is trying to present. Also include like reinforcement. Do they have access to reinforcement in that environment that they would have access to like at the clinic, where we can take leisure breaks and still engage with them? We also have the risk of potential for diminished quality and interaction. Some of those early learners really like those tickles, those high fives, and that physical play, which you can't give via telehealth just because of the computer screen. Is there somebody in the environment that could do that? And then we also run the risk of like the individual not being able to understand that that kind of reinforcement and that quality reinforcement can also come from like the BCBA or the behavior therapist when in-person session resumes again. We also have technical failures. Everyone's gone through it where we've had technical difficulties. That's a risk that we run just because of technology the way it is. We can't always predict when the internet's going to go out, or when like computer's not going to work, or the iPad's not going to work, or you maybe get Zoom bombed, like where people somehow get in no matter like how many fail safes you put in. So we just have things kind of like that to look at too. We also have to realize that recent research is still emerging on telehealth, especially within the ABA field. Like Taylor had talked about a year ago, I don't think I would have ever imagined I would be providing ABA services via telehealth ever. I think if you would have told me a year ago, I would have looked at you funny and been like, no, I wouldn't. No, I'm not. What are you talking about? It's not going to work. But actually, research is showing that it can be supportive and it can be beneficial. We also look at the lack of in-person support. We want to make sure that caregivers are around. Caregivers can focus on the session and helping to support the individual. Without their support, especially with some of those early learners, and even those elementary school kiddos and the ones that have trouble attending, we really want them there to support. And if we don't have their support, our session's not going to run the greatest. So that's another risk. We also look at interruptions. Interruptions can be anything as simple as siblings interrupting the session, mom or dad maybe gets a phone call that they have to take because of work, or an emergency pops up. Things that we can't control in real life are all going to be interruptions. And that's another risk that we run using telehealth. And then, like I mentioned, the potential failure of security protocols. So with Zoom, we use like password codes and unique identification codes, but they're still subject to potential privacy breaches. So that's just a risk that we run overall with using technology. So this is an example of like a risk mitigation flow chart that we use, and it kind of guides you through determining whether or not telehealth could be appropriate, and whether or not and how to minimize the risk of some of those potential risks occurring. So like you start off at the very top, obviously, with having the client or parents, has the client or the client's parents or guardians, and you go yes, no, and then you keep following the little flow charts. I mean, that's one tool that we use as well to determine whether or not telehealth would be appropriate. So yeah, that's all I'm gonna say on that one. Other things, so the ethical considerations for telehealth. So being a board certified behavior analyst, and then Taylor and I both also oversee registered behavior technicians through the board, and through the behavior analyst certification board, we have an ethical guideline and ethical code that we have to follow. It's pretty in-depth and talks about minimizing risk to clients, making sure we're providing the best services we possibly can. We're implementing procedures that are positive, minimizing the risk. They are supporting the individual, they're individualized to the individual, they're applicable. So we follow this ethical code as well when we're determining whether or not telehealth services would be appropriate. And then even during the actual session, we're making sure we're adhering to these guidelines and these codes for us. So go to the next one. So once you've determined that the risk is low, you've gotten informed consent, you've determined that telehealth is appropriate for your client, the next step is kind of planning how you're going to implement telehealth. And the first step is adapting your existing treatment plan. So you would identify which clients are ready for immediate treatment with minimal program modification. So whose treatment plans would you be able to transition from in-person directly to telehealth with very minimal modifications? Like maybe you just need to make some stimuli that you can share on the screen. And then you identify which clients are going to require substantial modifications to programs, teaching procedures, behavior plans. Do you need to modify not only stimuli, but maybe modify and train parents on how to run a specific program, such as like a sequencing program. Maybe you have to work with the client before going to telehealth to have them learn to attend to the screen or attend to the mouse and how to work the mouse or the mouse pad or how to touch and maneuver around on Zoom. So it's kind of like looking at who requires substantial. And then the last one, you want to look at which clients have barriers that prevent or require advanced problem solving. So especially like those, I think of like the severe problem behavior individuals, ones who engage in that severe problem behavior, whether it's physical aggression, self-injury, property destruction, even refusal, things that would really deter their ability to access the benefits of those direct telehealth. And maybe you would determine that those individuals, those clients that you have, that telehealth isn't the most appropriate for them because they would do better with in-person. So you kind of have three separate groups, ones that can transition directly into telehealth very easily and not have a lot of modification to your programming. You kind of have that middle group where you're going to have to do substantial modifications to the programming, but they could still benefit from telehealth if in-person services were to be disrupted for any reason, or if they want to supplement. And then you have that last group where you have lots of barriers that require a lot of problem solving and may not be the best for telehealth services. So the next step, once you've determined who and what kind of program modifications you need to make, is to train the techs. Whether they're like we have registered behavior technicians. We also have behavior technicians. We want to train our techs to confidently and effectively deliver that direct telehealth service. When I train my staff to run the telehealth, I've often done the behavior skills training, which we'll review later, on how to run it. I have them watch a couple of my sessions that I run, and then when they hop off on their own, I'm logging in for the first couple sessions to watch and provide feedback to them. So we're trying to make sure that they have the ability to be basically taught how to do it. They have the opportunity to role play, they have the opportunity to see it, and then they jump in and I provide feedback. We are always prepared to provide agenda and resources to create structure within sessions. We really want to make sure that sessions aren't just kind of like willy-nilly, fly by the seat of your pants. We really want them structured because that way we can keep the client on track, and we can also make sure we get all the goals and the targets, the programming in that we need to, while also giving them the opportunity to learn and have fun still with us via telehealth. We also want to make sure we have engaging digital resources. So whether that's finding fun games that you can play with the client online, or Boom cards is a really big one that we've used in the last year now since COVID started. Those Boom learning cards have been lifesaver for a lot of people, a lot of different programs on there. And then maybe you start your session small. If you're seeing a client in center for 6.5 hours, they may not be able to attend to the computer screen for 6.5 hours. So maybe you start with 10 to 15 minutes, you do a little break, another 10 to 15 minutes of work, and that's the day. And you slowly build up, just because it is such a big change going from in-person to having to attend to a screen and interact via the screen versus like having the person right next to you. We're also we teach our technicians to be flexible and willing to change the direction of therapy. So we want to really minimize response efforts when possible. We want to maximize using the natural environment to teach. That's a big one, just because it's hard to tell if a client's pointing at the right answer or not. And the natural environment provides a lot of rich opportunities for us to teach via telehealth, just because we can see and be like, oh yeah, I see a purple ball behind you. Go grab the purple ball. And it gets, not only gets the client up and moving, but also gets them in their environment, applying the skills that you're working on. And then we also want to make sure that we're maximizing reinforcement for parents and clients. We want to make sure the client is reinforced for the skills they're learning so that we can strengthen those behaviors. We also want to reinforce the parents because this is a new technology. We are asking them to be a little more hands-on, and we don't want to ruin that relationship with them, but it also gives them the opportunity to kind of take part in therapy with us. So we want to reinforce everybody. Go ahead. So we also have like what we call the workstation security checklist. And so this is an example of the one that we use for our providers. So the technicians, myself, Taylor, we provide this, and it shows the devices, and it kind of goes over that we're making sure that if personal devices are used, that we're not saving any of that private health information. No images are saved, or if they are, they're saved securely and they're encrypted, password protected, that they have lock screens requiring a PIN. All devices have automatic log off, and then the environment too. We kind of talk about making sure that if they are gonna keep paper records, that there's a way to keep them safely and securely, or that we're destroying them in an appropriate manner, that we're not visible through windows. Maybe use a Bluetooth headset. We have password protected devices and even Wi-Fi, and then protected video screens, just so that people who may be in your environment walking by can't peek in and kind of violate that private health information situation. So we want to make sure that the workstation is secure for us on our end. Go ahead. And then we kind of talk about family preparedness too with our families prior to implementing telehealth. We provide this checklist and guidance for families that kind of talk about like location preparedness. Like, so I meet with parents to talk about, okay, so if we're gonna do telehealth on this day, this is kind of what we want the environment to look like. We don't want distractions, so we want the TV off. We want video games and other types of competing electronics or even reinforcers, toys, kind of out of the way, turned off, not making noises. We want to try to remove pets the best we can, move siblings and everybody else unless we're using them in the targeted programming. Just because they can cause kind of some of those interruptions. Make sure the environment is set up for them, and they don't have the option to like leave the camera all the time. We want to keep them on the camera so we can see them and work with them. We also make sure that the tablet or the laptop or the phone or whatever they're using is charged enough so that we can run the entire session without being interrupted with something dying or battery running out. We also want to make sure that we have reinforcers located, or not located, but identified, and they're located out of their immediate reach, so they can't just grab the toy and start playing with the toy in the middle of a trial. We also look at making sure they have all the materials they need. Some of our parents, we do actually have given materials like worksheets we've sent home via email or via in person, they pick up in packets and we work on those. Or we make sure that everything that we need for the session is specific to that client and their programming in general. Go ahead. So things that we also discuss with parents: do they have a strong, reliable internet connection? We don't want the Wi-Fi going in and out or being unstable or lagging, just because it kind of creates issues within the session, makes it hard for us to have a smooth, continuous interactions with the child. We also want to make sure that the device that they're using has the webcam and the audio capabilities, and most of all the technology that we use nowadays has that. We want to make sure that the session occur in home, like in a room in the home that we can use. That's not going to be super distracting. Is there a place where we can store materials safely so that we're not having to constantly send materials home when not in use? Are all the dangerous objects out of reach of the individual during the session? We obviously don't want them getting hurt because we can't be there to block them from getting anything. And then we'll make sure that somebody's always close in physical proximity to the child, just because we may need them to assist us with redirection back to the screen or have them assist us with a specific program. And then just for safety, will someone always be in the home? We never want to provide telehealth to an individual when no one's home in case of an emergency. So then ongoing supervision, like Taylor had talked about too. Taylor and I both have lots of experience in supervising our RBTs and our behavior techs through Zoom. So we always are supervising the technicians. We're giving feedback to them. We're reviewing programs as they're being run. We're modifying those programs as needed, and we're using what we call behavior skills training to teach our behavior techs, to teach our RBTs how to run things, even how with some of our clients, we use the same tool to teach different skills. So we're always continuing to provide that hands-on supervision and monitoring how things are going overall. So then getting services started. So like we talked about earlier, we want to make sure that we have an informed consent form signed, that you're reviewed with the parents what telehealth is going to look like, what the goal is, what their responsibility is, what your responsibility is, what programming you're going to be completing. They have the opportunity to ask any questions that they may have. And if they sign off that yes, you've reviewed it with them, they have no questions, or they understand they can terminate at any given point, things like that. So you make sure the informed consent is signed. And then we also make sure we have the telehealth risk benefit assessment is completed. We make sure that the risk is low and that the individual will benefit from telehealth. We also determine which telehealth model is going to be best, whether it's just BCBA and client via the screen, interacting with somebody there to support just in case there's a need for redirection. Is it parents coming in and assisting with guidance from the BCBA? Is it a behavior tech with guidance from the BCBA? And then we also make sure that modifications to the treatment plan are completed prior to implementing telehealth services. And then we make sure that we have determined what level of support we need from the caregiver, whether it's just somebody in the home, those emergency situations, or they're right next to the client assisting you with the session immediately. And then we want to make sure that we have technologies ready. You've gone through kind of like a trial run with the parent or the guardian, make sure everything is working. Everybody knows how to operate Zoom or Google Hangout or whatever platform you're on. They understand how to run like that. If we give over control of the computer to the client so they can maneuver the mouse and stuff on their end, they don't know how to do that. They can log in, log off, they can do the chat box, all that kind of stuff. And then we make sure that all of our technicians are trained and ready to go as well for the session. Okay. So then the different service models, we have like partial telehealth, which is kind of a combination of both in-person and virtual. Maybe they come to the clinic for a little bit and then do a session in the clinic for a bit with us. And then maybe later on that night, we're doing a virtual where we're focusing on like independent living skills in the home with parents, or working on like a bedtime routine with parents via telehealth that way. We also have the caregiver consultation where maybe like the BCBA and the parent meet and kind of discuss how things are going, what problems the parents are having in home, what kind of solutions, tips, tricks they can use at home to help with their child. We also have the direct services with the telehealth clinical direction. So like having an actual telehealth session with the BCBA or a behavior therapist and the client, just face-to-face via the screen and working through it. And then we also have the caregiver implemented where the parent is the proxy and they're doing the session with oversight from the BCBA. And the BCBA is telling them, great, now I want you to run this program and this is how you're gonna run it. Good, now they can take a break, make sure you reinforce that kind of stuff for the caregiver implemented. And then I'm gonna hand it back to you, Taylor.
Sounds good. Thank you, Jess. So next, we'll kind of talk about the different models of delivery, different types of therapy, and we have some video examples for you too that are from YouTube. So when we talk about direct therapy, there's really kind of two models that we approach. There's a caregiver implemented model. So essentially the parent is functioning as a therapist next to their child, providing any prompting, reinforcing, providing any guidance to their child. And that kiddo is responding to that parent. And then virtually on the screen is a behavior technician or a BCBA who is providing that direction to the parent on what the programming needs to look like, what to say, what to do, etc. And then secondly, we have technician implemented. So the child is responding to the technician or clinician without the help of a parent. So an individual who's receiving technician implemented therapy has the ability to stay at the computer screen to respond to language delivered to them through the computer or the iPad or whatever the device may be. And something really important to note here is that you're working on the same types of goals and the same types of skills that you would in a therapy program at the center in the same ways. We're just really taking a more naturalistic approach. And after doing that kind of treatment modification analysis of what goals need to be changed, what skills need to be taught in the home environment based on a virtual or a telehealth delivery model, you'll have an idea of what that needs to look like. So we have an example here of what a telehealth direct ABA session might look like, with the BCBA on the right side of the screen and the parent and the child on the left side of the screen. So hopefully my technology, we talked about technology failures, will work right for us. So bear with me as I get this going.
So fill up this token board with all these smiley faces. See that? You see all the smiley faces I'm filling up? Wink. 1, 2, 3, 4, 5. Then you can have one of these things that you want to play. Which one would you like to do? Would you like to play a tiger game or play the Raffy song? Tiger game. Oh, that's what I thought. That's what I thought. So we're going to put the tiger game here. We're going to start with, can you see the picture of the dog?
Yep, that's Jody.
Yeah, that's right. So that's how we're going to play the game. We're going to ask if it's clean or dirty. So dirty, let's see if that's right. All right.
So that was just an example of a couple of different strategies that we would use in applied behavior analysis. So she uses a token board, which represents the child's independent responding. And after so many tokens, they get access to a reinforcer, and a reinforcer being something that's motivating to that individual and reinforces the behaviors or the skills that we've been focusing on or teaching.
Hi. Hey, Becca. Where do the legs go? Oh.
All right, I think I got that one figured out. Here's another example of direct therapy with caregiver being the facilitator. So we talked about the parent being there to help prompt, to help reinforce, to kind of shape those behaviors. So we'll show a little example of what that might look like. Hopefully. I told you guys, technology failure. Okay, so apparently we won't be showing you that video. Oh, here we go. I guess we will.
If she wants to do a quick one, we could always jump in.
I can facilitate the mouse.
Yeah, you have to help her on that one.
Okay. Okay, mommy, look at the screen. Look at the screen. Stop.
Okay. Oh, so we can do this one. She can finish this one. All right, Mila, which one is the mouth?
This one?
Yeah, good girl. Look at that. Find the hand.
Good, the right side.
Nice. So that works good. She points and you click. What tells you if something is stinky? Find the nose.
Okay.
Mila, show me your nose. Where's your nose? Yeah. In this
So in this example, the parent is helping Mila choose which item on the screen by kind of using the mouse for her after she points to the correct response. And then the clinician is providing those instructions or those kind of teaching moments, and then the parent is just prompting or shaping or reinforcing those. So in the next video example, after a few sessions, the kiddo, so Mila, begins after being taught. She learns how to manipulate the mouse. So she is in session without her parent next to her at this point, responding to those instructions from the BCBA. So I'll play a video of that. I think it just needs a second to wake up. Maybe, yeah, there we go. Okay.
Okay, yeah, we got them all correct. Okay, hit the green box. Do you know which one's the green box? You got it. All right, let's see. Can you go to the one that has, yeah, go down that way. Okay, stop there. Let's do, let's look. You can do the one that has the green signs, the one that has the zoo, or the one that has the soap.
That one.
Okay. Okay, this one you can do fast. Find the lion. Is it working? Yep, perfect.
So she's learned at this point, which may have been an addition of a goal for her to be able to facilitate and use the mouse in order to respond to the different programming that she's working on within her treatment plan. All right, so we've talked a little bit about the direct therapy piece of the telehealth model. And we've talked quite a bit about the involvement of families and parent training in the treatment package for each of our kiddos and our clients and our children. So most importantly for us, as we moved to a telehealth parent training model, really the application of the principles and what we're teaching them isn't changing. It's just how we're delivering that education and that enrichment and getting them involved. We continue to meet with caregivers regularly, empowering them to know and receive the information, ensuring that we're reviewing progress and goals and program modifications with them frequently. A plus of having kind of that in-home virtual piece is that they're involved pretty much consistently. So when you're in an in-clinic setting, we have the kiddos for 2, 3, 6, up to 8 hours a day. And we have interactions with them at the beginning of the day and at the end of the day to share that progress. But that's definitely a plus to this virtual setting when they're in session with their child. They're seeing how we're addressing the programs and the goals and the targets. So we want to continue to provide training to the parents. So whatever that goal may look like within the treatment plan, whether that be learning how to implement a specific goal that we're working on, labeling items, following instructions, etc. You want to receive consistent input from the caregivers too. Do they see that this is effective? Where's the social validity in that? Is there buy-in? Do they think this is helpful? Is it meaningful? Is it making a positive impact on their life and their child's life? And really, we need to reinforce their efforts. Parents these days are teachers and therapists and moms and dads and bus drivers and anything you can imagine. Our families are each day expected to do more and more. So we really have to make a huge effort in reinforcing their efforts in their involvement in the therapeutic model. So when we talk about training our parents from an ABA perspective, we use a model called behavioral skills training. And essentially there's 4 steps of this. This can be done in person and this can be done virtually. We take this training model and apply it to our families becoming more familiarized with the application of the skills that we're teaching to their child. With our behavior techs, we use this model. So essentially these 4 steps are an instruction period. So we're teaching, we're talking, reviewing the concept, modeling. So the one who's teaching is modeling what that skill or that training topic looks like. Then the parent or the tech rehearses that with you, so they practice, and then we give feedback. So we use this model when we are working on the involvement with a parent. Maybe they're learning how to implement. Mila was working on identifying animals. Maybe we want to teach the parent to be able to run that program, so we use a BST model. So here's an example of what a parent training session might look like, delivered via telehealth.
Okay, so just remember today we're going to be focusing on following through whenever we place a demand. So you might want to set a timer for him, and we're going to be working on an activity that's not his super big time favorite. What are we going to be working on right now, Mom? Okay, we're going to be working on coloring book and his markers, and I have the timer. Perfect. Okay, so how long are we going to work for? I believe you told me that right now he can only do about 3 minutes, so I'm going to set it for 3 minutes. Perfect, that's great. Good job listening, Mom. Okay, so timer. Okay, let's color. Okay, Mom, so I'm going to need you to get up from it. I don't know what to do. I totally get it. So right now he's trying to escape the demand, and we're going to have you get up from the table. I'm going to have you walk towards him, and you may need to get him and actually hold his hand, hold his little arm, have him come back to the table, and restate the demand. First, we're going to color, and then maybe you can have a super fun surprise that we can work for now.
So in this example, she's giving her kind of direction and feedback on following through with a behavior intervention plan that they had developed for in-person treatment. And so mom is applying those strategies at home with her child. All right, so here's another example of a parent training session. In this example, the parent is actually implementing the programming. So the skills that we're teaching, I think this might be Mila again. So we'll look.
All right, so what you're gonna wanna do is just set the camera so I can see both you and her. And the materials, yeah, the lighting looks pretty good. Okay, and then we're gonna do the flashcards right now. So it's just, right, that's the program we're gonna run. Okay. Hi, Mila.
Mila, say hi. You say hi. Hi.
Okay, well, good. We'll start with the wave, but I like how you're prompting her with her words.
Okay, so let me see.
Okay, I'll go ahead and take the data for you. If you just like indicate if one's not correct and you prompt her, I would just give her the full prompt. So if she doesn't answer and you've already kind of waited like the 2-second delay, just tell her like, see, this is cat, and then you can put it back in the mix and we'll redo it in a couple of new cards.
Right. So here at the BCBA, you can hear her speaking. She's giving mom direction on how to give the instruction, on how to prompt her child to respond correctly. And then she also will give direction on how to provide reinforcement for correct responding as well. So. All right, so we thought it would be important to just include some other parent training resources for you all. It's a trying time for our families, and anything we can do to support them and make them feel more enriched, more educated, we want to do that. So we included some resources here that have been helpful in our own practices for kind of shaping and providing involvement and training opportunities for our families. Here's just a few research articles supporting caregiver training via telehealth. This has been happening, and this is just more recent too, within the last year or so, these articles, but throughout the, implying that parent training can be done via telehealth. This has happened before COVID. So there's always been some kind of inclusion of telehealth for caregiver or parent and caregiver involvement as well. So that is kind of our conclusion. If you want to connect with us, we're on pretty much every social media platform. We also, within behavior care specialists and ABA eCare, we provide free parent webinars each month. For December, one of our BCBAs spoke about holiday stresses and managing those. In January, I think we're talking about telehealth. So feel free to share that information or join yourself. It's not just for parents. So with that, I think we will stop.
Hey, Taylor, somebody asked if you can go back to the list of books.
Oh, yeah, definitely.
Back to that slide. Perfect.
There you go. Take a screenshot. Is there, I don't have my clock up, 12:56. I think we could probably open the line if anyone has questions or comments for us. Michaela, if you have anything.
I don't have anything, but it's open if anyone has any questions. So.
Okay.
And it looks like there was a question, but it looked like Jess answered it in the chat that do you complete the diagnostic evaluations in Aberdeen also, or does one have to travel to Sioux Falls for this? And it looked like Jess said they have a clinical psychologist who works for them, and she travels to all of our centers, and she believes that she can do the evaluation.
Yes. Yep.
Okay.
In case anyone else was wondering and didn't see it on the chat.
Thank you.
Yeah.
Okay. Well, thank you everyone for joining with us. I hope you have a wonderful afternoon and stay happy and healthy.
Yeah. Happy holidays, everybody.
Bye.
Bye.
Bye.